Carol Harnett with a one-take Work.Love.Play Daily video blog. And I'm sorry I've been on the go a lot lately, but there's something I've really been wanting to do a message about since it came out. And last week there was a study that was released, got a ton of coverage in the media, about a Lancet study on the impact of aspirin and cancer. And it got, as I said, a ton of coverage, and it was important because obviously people are really interested in the topic. People have been interested in baby aspirin for a while from the standpoint of preventing heart attacks and strokes. I'm sorry, I'm rushing. I need to slow down. Heart attacks and strokes. And so what was important about this study? Well, a number of things. The first thing you need to know is that this study is actually not a study in and of itself. It's what's called a meta-analysis of the literature. So it combines a bunch of studies and tries to see what trends it can find. So that's the first thing you need to know. The second thing that you need to know is that there were not enough women in the study for the results to be conclusive. The third thing that you need to know is that taking a baby aspirin, or actually a little bit less than an American baby aspirin, because it's 75 milligrams, and an American baby aspirin, if I recall correctly, is 80 milligrams of aspirin, the study did not show that cancer was prevented by taking a baby aspirin every day. What it showed is that people survived, that they lived longer with cancer. So it doesn't change cancer incidence, it changes cancer mortality, and it does that for specific conditions. Again, that is specific to men, and the impact is seen in men over 45 approximately to about age 75. That was the study population. Now, women, they're assuming may have the same reaction, but they're not sure. Again, not enough women in the study. And what's important to know is many women, for the heart attack and stroke prevention piece, had stopped taking baby aspirin based on a very good study that was done a couple of years ago, showing that women who took a baby aspirin every day actually had a higher incidence of stroke. So here's the conclusion. Make sure, number one, that you don't just necessarily jump up and follow advice of what you're seeing in the media. It's interesting how medical surveys and research have become media news. That said, there was a lot of emphasis in this article about your importance of going to your doctor, and that is critically important in this study because there are side effects to taking baby aspirin every day, and there are also contraindications if you take other medications. So, for example, if you have atrial fibrillation, what's also known in the slang as AFib, you cannot take a baby aspirin every day, or at least you need to discuss that with your doctor if you do. Third, you really need to understand if you are a female. We don't know if these studies apply to us, so you probably need to wait to see if that impact is indeed carried over to women. We cannot assume that we react the same way because we do not react the same way with baby aspirin and stroke prevention. The other thing you need to know that I didn't talk about is a lot of the aspirin literature up till now has been specific for people who've already had a heart attack or a stroke, and it's been more preventive oriented, or if you have a significant history of heart disease, then it's seen as something you might want to do. So again, great meta-analysis of the literature. We have to see when you talk to your doctor as whether it's potentially applicable to you. Women, again, cannot extrapolate these results to us, and it's just yet another example of how you have to read carefully. I continue to be fascinated by how the medical research is now media news. So, this is Carol Harnett with the one-take Work.Love.Play Daily video blog, hoping that you're having a great work day, that you'll enjoy some love today, and don't forget to play. Thanks.